exciting session because you have seen the principles, you have seen the implementation, and now it is the interactive session. I think this is a really good thing to learn from the experts as well who have left the mark in risk assessment. Dr. Osama Ahmed Aslan is an associate professor of One Health at the university in Sweden. So Osama has a substantial experience, over 20 years experience, and his work is mainly based on 3 pillars of research: teaching and service. So his research focus on threats at human, animal, and environment interface. So you can call it the ecosystem interface approach to confront those ones which we are faced. So we are faced all the time. He has been involved in many preparedness and response activities and projects for emerging and re-emerging infectious disease in Africa, Middle East, and European Union. So we will hear from him. And Dr. Aikira Ranma Okoli, please accept my apology if there is a mispronunciation of your name. He is a senior consultant veterinary in public health. Who say veterinary in public health, automatically it is One Health. So working with the Federal Ministry of Agriculture and Rural Development, Department of Veterinary and Pest Control Services on Zoonoses Control, and Desk Officer for Rabies. So we have had a Rabies, World Rabies Day only a few days ago, and he played an excellent role and contribution as well. So he is an interactive member. He's a member of the One Health platform, helping to set up and internationalize and operationalize the One Health at the subnational level as well. And is trained in joint risk assessment, and is training in that one as well. So I will leave the floor for you to introduce the interactive sessions, how we're going to work together, with the audience. Thank you. Over to you, please.
Okay, thank you so much, Dr. Tieble, and me and my colleague Anma will guide you through this case study. We are glad that some of the presentation put the basis for this case studies. So many of the concepts are going to be familiar with you, and an opportunity for you just to practice what you have been hearing. So this is a qualitative risk assessment because the time is short and it is within emergency event. I'm going to read the scenario, so please just focus with me. There is a rural village in a remote region of country X, and the village is located near the border of country Y in East Africa, and the animal breeders in the village cross the border of country Y and sell their livestock at country Y market. The area is known for raising animals and practicing agriculture. It's a part of regions that provides the whole country X internal market with livestock and export to Gulf countries, particularly Saudi Arabia, to meet the significant needs during the holy Muslim Hajj season. In year X, there was a heavy rainy season in the village, and after 1 month of the heavy rain, there were rumors spread that many persons developed febrile illness, while some have died. The symptoms were described as headache, fever, and influenza-like disease. The rumors indicated sickness and death in animals as well. The media reported that 30 persons fell sick and 5 died. However, the report did not provide further details of cases and deaths in animals. Let us start our task right now. At this stage, what are the challenges that could be associated with assessing the risk of such event, and how do you address these challenges during your preparation for the risk assessment? So we would like to hear your voice. We can allow you to take the mic, but very briefly, you can suggest one of the challenges and how you how this can be addressed during the preparation. Any suggestion from the floor? Scott, you can help us if someone raises hand.
Yeah, so if you raise your hands, then I can unmute you. Also, feel free to, if you don't want to speak, you can also put some answers in the chat box as well.
The chat box, I have to look at the chat box. Security, okay. One said security. What do you mean by security? We didn't mention that the area is unstable. We just mentioned it is located in a remote area. Okay, any other suggestion with regard to challenges of this context of this event? Okay, all right, here and there. I would also need the presentation. Okay, we need a real evidences. Absolutely, this is what is going to be within the scenario. Accessibility, well, good. This area is quite remote, and we need to get sure that how these people reach there, how we're going to provide them with the necessary accommodation. They would have the equipment with them. So maybe we need to discuss this with the local community leaders. The area is remote, so we have to be sure that we will take all the resources with us, and we should expect what we are going to do there. So all the resources. So for example, if we're going to conduct epidemiological studies, so we need to have expert people doing those things and so on. And if we are going to do laboratory diagnosis, we need to have those people with us, of course. What other challenges? Okay, let me add from my side. One of the most important challenges, this outbreak started with rumors and media report. It did not start with notification from the surveillance system. What does that mean? What is the implication? When we start with rumors and media report, the outbreak might take place earlier than this time, possibly. And if this is the case, then we might miss some transmission chain of this disease. And also the second thing that the team is going to work under high pressure, because this is something addressed by media and addressed by rumors. Okay, let's go ahead and once you know this is addressed by media and rumors, then you need to deal with this by being transparent, by addressing the risk assessment process. So you try to take the lead again, because the lead right now on the side of the media and rumors. Who should be part of the risk assessment team at this stage, according to the description of this background? Yes. Okay, veterinarian, excellent, because we talk about animals. Doctors, absolutely. Environmentalists, why not? Ecologists, why not? Community, absolutely. Epidemiologists, indeed. All of those are quite good. Microbiologist, the personnel from the health industry, okay. Laboratory staff, yes, wow, someone said risk communication officer, okay. That's good. All of those could be absolutely involved there. And let's go further in the scenarios then. A joint risk assessment team was deployed to the affected village to investigate the possible etiology of the disease. The team started gathering information and interviewing the patient and their families, as well as the families of patients that died. The team recognized that many of the men patients were working with animals as breeders, while the women patients were taking care of animals at home. Okay, among the patients, there were also people who lived in the same village but had no contact with animals. The veterinarians heard rumors from the villagers of abortions in ibis and deaths in lamb and calves in the area. The villagers were reluctant to talk to the team, as they were concerned that their animals would be quarantined and potentially killed. So during the mission of the risk assessment team at the village, they found that some of those who developed fever and flu-like disease recovered in a few days. However, some of the patients have been seriously sick and sent to the neighboring health facilities. After a few days, some of the hospitalized patients developed signs such as petechial hemorrhage, gum bleeding, meningitis, ocular problem, and renal failure. Okay, within 2 weeks, the total number of patients reached 50, including men, women, and students at school. And the population of the village is about 2,000. On the animal side, more diseases in young animals and abortion have been detected by the veterinarians. Biological samples were taken from humans and animals and sent to public health laboratory and veterinary laboratory, respectively, in country X. So now we elaborate further about the case. At this stage, what cautions will be applied while you are collecting and transporting the samples to the lab? Yeah, do you help me within the chat? Yes, use of personal protective equipment, absolutely, measures. Excellent, thank you, Flex, because there was an indication of hemorrhagic fever. So this is the most important things to avoid, yes, to avoid the contamination of the containers of the blood samples, which should be mostly a plastic one. Yes, avoid the mixture of the label of these things. Communication expert is key. Yes, strict IBC, excellent when fair. This is exactly because we said that some of the patients sent to health facilities and they developed hemorrhagic fever symptoms. So we have to be very careful and applying very important infection prevention control. So maybe even we should have like an isolation center or department for those people until the result will come later. So thank you so much actually for this excellent input. What are the important control measures that need to be implemented at this stage? If you want to raise your hand, Scott will allow you to talk. If not, you can write in the. Someone mentioned also the issue of the transportation and the triple backing. Absolutely, triple backing. That means we take care of the samples while they are sending, and triple backing is the best way recommended actually by WHO, by safety and securities. Let's go for the next question. Excellent input, guys. What are the important control measures that need to be implemented at this stage? Yes, in both quarantine, in infected animal sanitation, safely and hygiene. Sounds good. Prepare and dispatch the rapid response, proper sanitation. Okay. Isolation for what? Now we have both. We have animal and we have human. So are you talking about human or are you talking about animals? Okay. So it seems to be that there was like animals, there were dead animals, there was aborted animals. So we need to deal with all of those in a very biosecurity restricted measure. And for humans, indeed, when the medical and paramedical deal with humans, they have to use the protective equipment. Okay. What other control measures? We talked that animals could be a part of this. So yes, quarantine. We need to quarantine actually the area, particularly for animals. And if there is a great risk also for humans, the issue of quarantine could be also discussed for this area. So the quarantine, indeed, is quite good issues. Isolation and quarantine, both of them. Contact tracing. Oh, this sounds really interesting. Indeed, contact tracing, but right now we do not know exactly what happened. So maybe we can go further and see if contact tracing is more relevant in the next stage. Okay, let's go ahead. After 1 week, the veterinary and public health laboratories confirmed that this was Rift Valley fever infection in both animal and human. This is the first time that the disease was detected in country X. However, Rift Valley fever has been detected previously in other neighboring countries where strict measures have been applied, including livestock export embargo. Well, at this stage, what aspect of disease transmission has not been consider so far in the investigation. We talk about Rift Valley fever, and we mentioned animal, we mentioned human. So what aspect of disease transmission not considered so far? Yes, vectors. Indeed, vectors. If you go back to Rift Valley fever, yes, the environment and vectors. Indeed, both of them. Those need to be considered. For the environment, particularly the mosquitoes, and if there is any water dambu or water bond that could help actually mosquitoes to amplify, you need to consider that also to control them. Now we have a good background about what happened actually, and some good information about the disease itself. So now we need to frame the risk of Rift Valley fever. You have had some good discussions and some presentation describe how you frame your risk frame, the concern. So what would you include in this risk frame of this Rift Valley fever? Yes. Migration of animals, excellent. This is really good within the risk frame. What else? Water safety should be improved. Okay, so we are talking about a concern about water safety. You know, the people are disturbing me. Some of them, they are saying the workshop is excellent. Some of them, they are asking about the certificate. So let us just focus. Let's focus on this, and then we'll come back to those. Isolation of animals from human, excellent. Yeah. Vaccination, that's really great. So vaccination for whom? For animal or for human? I need vaccination for animals, pest control or vector control. Okay, all of those could be there. Yeah, well, some part of the worriness could be also, you know, the morbidity and the mortality in human side, the morbidity and the mortality in animal side. Don't forget the livestock market. We mentioned them within the context. Those are important within the transmission here. Don't forget the slaughterhouse of animals also. All of those things has to be within the framework of this Rift Valley fever risk assessment.
And you will also recall that this particular province exports animals to as far as Saudi Arabia. So that's going to be a concern, impediment to trade because of the disease. Excellent,
Enma. So Enma mentioned very important issues that this country or this region provide not the whole of the country, but also they export the disease to neighboring countries, particularly Saudi Arabia during the heavy season of Hajj Muslim. They really slaughtered millions of livestock. So we need to consider that here at the risk frame and also later at risk questions. So what about the risk pathways of Rift Valley fever that should be looked at by the team? We started with the risk frame, and then we should formulate, discuss them. We should drive the risk pathways from the risk frame. Okay. The risk pathways. We have animal, we have human, we have mosquitoes, or we have vectors. So the risk path, let us have it from animal to animal. How the disease can be transmitted between animal. Mm-hmm. Yes, in terms of animals, just through the vectors, the disease can transmit between animals to animals. And there are some discussion that also wildlife could be a reservoir, so the disease can also be transmitted also through vectors to animals. There was a discussion if there is a direct contamination, the direct transmission between animals to animals, but I can't see strong evidence so far. There are some evidence, but that cannot be concluded as the strong evidence. Okay, how the disease? Yes,
you're also looking at animal products.
Animal products
transmission through, yes, animal products, either congestion or coming in contact with the blood of fluid of an infected animal during processing or any other. So that's also a possible risk. So by risk pathway, you're looking at all the possible main routes of transmission of Rift Valley fever.
So now, Emma, we started with the transmission between animals. Now we move to transmission from animal to human. So what you mentioned absolutely is from animal to human. So from animal to human, how the transmission will be, as you said, direct contact with infected animals, their fluids. You could also use unpasteurized milk. Absolutely, animal secretions. You can be exposed at slaughterhouses if you are working there, if there are any infected animals. So all of those have the possible. Also, mosquitoes or vectors can transmit the Rift Valley fever from animal to human. So now we look how the disease transmitted between animals and also how it is transmitted between animal and humans. Let's go ahead. Now we describe our frame risk. From the frame risk, we discuss the risk pathways. Now I want to suggest some risk question related to this Rift Valley fever in order to be assessed. How do we formulate the risk question? If you follow the sections earlier, the question should be really specific, and we need to talk about the likelihood and impact. Yes, yeah,
and
yes,
impact.
Emma. Yes,
the
likelihood.
risk question, the risk, likelihood, and impact. It should start with those. What is the likelihood and impact of?
Yes, and what's your population?
When, where,
Yes.
and how. How, the source, where, the location, when, and so all of these components must form part of your risk assessment questions. So can you give a try?
Excellent. Yes. So with the tips given by Enma, can you help us? Can animal product be a risk? This is just a concern. I don't think this is a risk question. You need to reformulate it.
Yeah, and the risk question should also be at the animal environment human interface.
Indeed.
A joint risk assessment question.
Excellent.
So I can give an example and maybe you can try and others can also give us some. And I have here, what is the likelihood and impact of at least one person in the province becoming very ill from this event? Well, from Rift Valley fever virus during this outbreak by coming in contact with the body fluid of an animal in the slaughterhouse.
Okay, so this is a suggestion for Emma. Try to give you one example, but I can see one of the participants made a good trial, but he jumped to the international risk. So he was because this country X is sharing border with country Y and also exporting animals. So he was trying to ask about the possibility, what is the likelihood of introducing Rift Valley fever from country X to Y. So let us help you to reformulate this, Rogers. So yes, what is the likelihood and impact of introducing Rift Valley fever through livestock export to country X, for example, within the next 6 months or during the season of Hajj, for example, if we are talking to Saudi Arabia. So that could be a risk question, external risk question. But if you focus on the local risk questions, could you help us with more?
Okay, I'm looking at something in the chat.
Yeah.
In the chat box, it says, what are the possible factors of Rift Valley fever outbreaks in animal and human? That will not qualify for a risk assessment question. Can somebody just say why? Because it doesn't start with what is the likelihood and impact. A risk assessment question would usually start with that. What is the likelihood and impact? And then there's another one, the likelihood and impact of a butcher contracting Rift Valley fever by slaughtering a suspected sheep. It has all the components except the time.
Yes. So Rosalina, Enma was trying. She asked. Rosalina asked why. Enma was trying to say that the question was not formulated in a way that what is the likelihood and impact, and also you need to consider when she said like when and where, and
When-
also the population. So you have to include all of those in this. Someone, Daniel, he's trying what is the likelihood and impact of a butcher contracting Rift Valley fever by slaughtering a suspected sheep in country. Yes, in the next 6 months. Excellent.
Yes.
This is an excellent
Yes.
trial, Daniel. Thank you so much.
Very
Yeah,
good.
you are in the right track. You are in the right track. Okay, good. And you can formulate more and more questions according to the context actually of the scenario and according to the context of the country. And also you could look for this question of the likelihood and impact of Rift Valley fever disease to be transmitted to 3 regions actually in country X itself by animal movement or by livestock trade in markets. So those questions also are quite important. Maybe you can have them within the next 6 months or during the rainy season, if we say between July and November or something like that. So think of this kind of important risk questions for you. And this risk question is the one that we are going to make the characterization against them. Would you like to add anything? And before we go quickly to the risk characterization, because we don't have much time.
Oh, sorry. Were you talking to me?
No, that's fine. I was saying if you have anything else you would like to add, but I think we can go further to the risk
Okay, yes, from
characterization.
the risk questions, then you go straight to your risk estimate. The likelihood is very high or low. What do you think? And then you will remember, as Dr. Makama said in his presentation, you must be able to give your level of confidence. Why do you think that the risk is high or low based on your questions? And with that, you plot a matrix, the risk estimate matrix, and then you see where it falls. So again, what are the possible risk characterization of your risk questions? So let's take one of the questions and imaginarily say this.
Yes. So first of all, the concept of risk characterization means the likelihood and impact of this risk question. So we need to apply this the matrix. So let us take the question of our colleague who mentioned just a few minutes ago, was talking about what is the possibility, likelihood and impact of a person or butcher, I can't remember, contracting Rift Valley fever in a slaughter house during the next 6 months. So this question, the likelihood, in your opinion, with your team, is it going to be high or moderate or low? And the impact, if this happen, what is the impact if this happen? Is it going to be high, moderate, low? This is what is meant by the risk characterization. So if we develop like 4 risk questions, we have to go one by one for these risk questions and see them within the matrix, the likelihood and the impact. And at the end, we can make the overall, actually, according to the available data and the expertise of the team, we can make the overall assessment, risk assessment, but we have to decide the level of the confidence on this risk assessment, because this is going to inform the decision maker and also the management later. Does that make sense? Let me just have a look at the chat. So this is how the risk characterization, handling a pet or animal when you have a lowered immune system. Okay, this is a risk question, or if this is a risk question, you need to formulate it in a way that we said last time, like the likelihood and the impact of someone handling affected animals, someone with weak immune system handling animals infected with Rift Valley fever. So far, there is no much data about the pets animals, including in Rift Valley fever, mostly livestock, sheep, cattle, camels, and a buffalo from wildlife to some extent and so on. But there is no evidence with regard to pet animals. Okay, let's go ahead. Now we characterize our risk questions and we check to what extent are you confident about your risk assessment outcomes? This is we discussed, and let us go how do you operationalize the risk assessment outcomes? So now you made the risk questions and you put them in the matrix, you know to what extent their likelihood to occurrence and their impact. How you are going to operationalize these outcomes of your risk assessment? Any suggestions? Operationalizations means make it work. How would you make this risk assessment result or outcomes working and implementing? Okay.
So to save time, maybe I can just help here.
Go ahead. Go ahead.
Now you have done your assessment. What next? You have finished your assessment. You have to do you review the process, and everything must be documented from the risk pathway to the risk question, from the framing, risk framing. All of them must be documented. The process must be documented. You review your process, and then you make management and communication options. And this will form the basis of response to the outbreak. What are the managed? You have to make a recommendation after your assessment. And that is so that the output will be utilized by management. And then if, of course, there are gaps, you can now plan for a future reiterative meeting where you can look at new evidence to improve on what you have done. Yeah, so that is.
So someone, I was looking at question and answer. Someone said the operationalization of risk assessment is to develop risk communication. Well, absolutely. And risk assessment, including risk management and risk communication. So tomorrow we are going to take the same scenario and we will complete it with the risk communications and question related pieces. So absolutely, within the management and within the mitigation of the risk, there will be risk communication. Thank you so much. Operationalization of risk assessment is to develop risk management and risk communication. Indeed, you are agree. We agree with you guys. This is good input, actually. It depends on the country context. Also, you will find the structure that will implement this management. So it might be there might be steering committee or technical committee is going to do that, but there must be a leadership actually for doing that. Okay. Accordingly, suggest risk management options based on your risk assessment outcomes. You see, all of these things are highly interconnected. We start with the risk framing. We discuss all the things that can concern or worry us about Rift Valley fever. From there, we took the risk pathways. From there, we developed our risk questions. And from those risk questions, we try to put them on the characterization aspect, the likelihood and impact. And after we check the confidence of our assessment outcome, we try to find a way to operationalize those risk assessment outcomes. And finally, what risk management options that we will carry out based on these risk assessment outcomes. Could you help me, please, in the chat? Okay. Formulating of risk communication technical working group. Good. The second question, the frame is not clear. Okay. Well, when we say risk frame, that means you are going to consider all the things that can be a concern for us regarding the disease. So, for example, the hazard here is Rift Valley fever. What is the symptoms of Rift Valley fever? The fatality case, for example, the level of morbidity, the level of mortality, if there is any information regarding the virus itself, the mutation, subspecies, and we look the context, how the transmission of Rift Valley fever take place. Here we are talking about animals. What about the livestock markets? What about the slaughterhouses? So all of these things, which can worry you, worry the team, and also worry the public, can be included actually within the risk frame.
Yeah. So part of the risk management options may include vaccination of the animals at risk with appropriate vaccines. It may include movement restrictions. These are all, or improved surveillance. Like someone said sometime earlier, case tracing, contact tracing. So this may improve surveillance so that you can detect even cases that are not so, that have not gone to the hospital or presented anywhere. So this will include part of the risk management options that we might recommend, including risk communication, of course.
So the management options, as Anima said, first of all, you need to strengthen your surveillance, and your surveillance here has to be integrated surveillance, collecting data from animal, human, and also environment, which is here the vectors. So you have to have it in an integrated way. So you need to find a way to do that. The second thing, yes, the vaccination. In this case, there are neighboring regions actually under risk of Rift Valley fever. And we know that this place is providing different country with livestock. So we need to vaccinate not in the infected, within the infected area. No, be careful, don't do that. We do the vaccination in areas out of the infected zone, so we can vaccinate them there. And mostly, if there is a possibility, we can do like what is called like a ring zone, maybe up to 20 kilometers, if I'm accurate. That will help us actually to avoid the spread of the virus to other areas. And of course, restriction of movement of animals. But this has challenges. If you restrict the movement of animals, actually, how these people are going to provide animals with food and with water. So if they don't have sources of food or water, you need to consider that. Otherwise, it will be very difficult for them to comply with you. And this will create a big lack of, it will create a problem of distrust. And we do not do that. We do not want to do that because this is going to have consequences on the risk communication that we will have a separate session related to it tomorrow. So we need also to do some infection control measures, more and more infection control measures. But what about those sick people? We need to be sure that there is a protocol of treatment in place and all the specialties needed for those people. You know, for some cases of Rift Valley fever in human, they have complications, and those complications need advanced intervention, like renal dialysis. Those might not be available in this rural context, very small village. So you need the health system need to be ready to transfer these people to well-equipped actually hospital where they can get the necessary. And this is the way how you build the trust with the people. Later, if you want the people to comply with your instructions, they have to see that you are serving them in a proper way and also respecting their cultural values, their social concerns, and stuff like that. Otherwise, later you will face problem. If you just fix immediate problem by taking tough measures without considering any concern of the local community, you will face a big challenge actually later. Let me have a look at the chat before we end this session. Yeah, increasing capacity building and intersectoral cooperation. Absolutely, this is the essence of this workshop. Thanks for reminding us about this. Any other management options that we forget about? Of course, the vector control. But by the way, the vector control is very costly. If the area is small, then you will absolutely try to do that. You will try also to advise the people how to protect themselves from mosquito bites. This depends on the type of the mosquito itself, because you know there are different types of mosquitoes having different behavior. So if you know the behavior of the mosquito transmitting Rift Valley fever, if it is active at night, for example, then you will advise the people to use impregnated bed nets. They can also use, you know, the long sleeves, clothes, mosquito repellent, and so on. Those also are quite important management options to avoid.
Those will form part of the risk communication plan.
Yeah, absolutely.
Communication.
Yes, they can be involved in the risk communication, but they are part of the management options. Yes. Okay, question and answer. Let me have before we have still like 5 minutes. Control slaughterhouses. Oh, this is excellent point. Indeed, the slaughterhouses could be a source of the infection for Rift Valley fever. So we need to control it and apply a very good biosecurity measures. Animal movement and trade. Yes, we need to organize the trade. And remember that this country is exporting livestock to other countries, including Saudi Arabia, as you said. So what kind of management that we are going to do? What measures we will do in order to avoid Rift Valley fever transmitting to these importing countries?
You could consider compartmentalization of a disease-free area and keep it free from disease for that purpose.
So OIE or WOHA, now the new name, WOHA, yeah. They have a guidelines actually during the outbreak of Rift Valley fever for the export of livestock. It's really restricted. So you need to get sure that animals are free during the period of quarantine, maybe 2 weeks, around 2 weeks, and they have to be vaccinated. And they will take samples there on the other side in the imported countries, if we assume Gulf countries. So there are a lot of actually measures need to be done. In the past, usually there is embargo, but OIE or WOHA, they tried to actually decrease these restrictions, but still very tough to comply with the requirement in order to continue exporting your animals. There is another also challenge that, you know, when there is a risk of Rift Valley fever and it is related to animals, many people will stop eating meat. This is also would definitely disrupt the chain of the animal production and will push these farmers into poverty and challenges. So the risk communication, this is going to be the role of the risk communication that we will discuss tomorrow. They have to deal with this kind of fear and concern. Yes, Enma? Would you like to add something?
No, that's fine.
Okay.
Yes.
Someone said, I think we first consider population at risk and work upon accordingly. Absolutely. Population at risk, and both human population and also animal population. So what population at risk, as you said, particularly, it seems that the disease is occupational, but not only occupational, because we saw that in the scenario, yes, many of those men and women has had to do with animal breeding, but also we have had students at the schools. So how did those students contract Rift Valley fever? It seems to be that the vector also has had, vectors had a role in the transmission of the disease in some part of this village. So the focus should not only be on those handling and dealing with animals. It could also include the rest of the community because they are also vulnerable to mosquito or vectors bites, and those has the capability to transmit Rift Valley fever. In the past, this is constant total awareness. Yeah, that someone talking about increasing the awareness. Absolutely, that will be within the risk communication. Indeed, at what stage is appropriate for risk communication and community engagement to conduct risk assessment during an outbreak? Well, Hendrina, I think risk assessment, the risk communication should not just be at the time of by the end of the risk assessment. No, while we are doing the risk assessment, we can communicate, but we can communicate something different. Even we can communicate the process of the risk assessment to decrease the fear of the people and to try to calm down the rumors until and tell the people that you will share with them the results soon. That will make a big sense. I think Mark is trying also to type and answer you. That's good. Yeah, let me have a final look for the question and answer. Plots at what stage is I did control the slaughterhouse. Yes, that's correct. Someone else mentioned that. public education and massive community involvement. Indeed, all of those are excellent issues. I think we should, by this, Emma, I think we try to apply what others have been trying to say during the sessions of the principles of risk assessment of today, taking Rift Valley fever as a good example of zoonotic disease at human, animal, and environment interface. Thank you so much for being very active. We hope this session was useful for you. And we are, it's the floor with you, back to you, Scott and Tieble, so you could have 5 minutes to wrap up.
Okay, thank you very much, Dr. Osama Ahmed. Really, this is a very good interactive session, and we still have some well-dedicated participants. And I'm not saying those who left are not well dedicated, depending on their program and the plan as well. But it was very interactive. And these are the questions usually we face in real life, because they are very challenging questions that we face them daily. And we have an outbreak of Rift Valley fever, and we need to address these questions step by step. And sometimes we address all simultaneously. But what is important here is the information, exchanging the information at each stage, and that needs to be interactive and transparent and comprehensive enough for decision for risk assessor to come up with a good outcome. And usually what happens is the risk assessors and decision makers, scientists, opinions, and perceptions are gathered from all sources, including from local community or regional or district or county, and even international expertise are to address the risk questions for better decision. And it is a dynamic process, interactive, of course. Now, we have learned about the principles, the implementation, and tomorrow we will continue the session. And to be able to close this session, I thank all the organizers as well. Thanks to the panelists, and thanks deeply the participants for the active participation and learning. And so this is the end of the first day, and the recording of this session will be available, and with all the additional material to all of you, and the link will be shared as well. And you have seen the link in the chat, and my colleague Mark even put the presentation already. But all will be compiled, and you will have you will access to the presentation, you will access to the tools, and that's what we are here for. And one of the most important issue is to support the country to conduct risk assessment whenever you need it, and we are available to do it. And we conducted those workshops with UK Health Security Agency and Chatham House, Pandora teams member, and FAO and WUHA as well, and UNEP. For all, we are one organization now, because the quadripartite and all the partners with Africa CDC, as you know, we work together close. The aim is one, to better support member states and to achieve the global health security. And that's we need all your support as well and dedication. And so please remember that to be eligible, a certificate of attendance will be delivered to those who request it, and presentation, again, you will have it, and but you need to attend at least 80%. So we expect you to come tomorrow as well to participate actively in the following the next session, which will be great. How to communicate, and communication, again, it is very important. So there will be evaluation form online. My colleague Scott and Adam and others will share, and you will have access to that one. It will be sent via email. So we will have the contact, the network here, which is very important for us for the future event and for the workshop as well, for any support you need, the country need. But please do not email individuals, and we have an appropriate channel how to go about to organize a workshop, whether you pass through the right agency in the country, and you have a FAO office, you have WUHA delegate, you have WHO office, you have the One Health platform in the country, you have the UK Health Security Agency. They operate in many countries, and they have a focal point. Please do liaise with them, and we will support you. Again, this is very important to note. Okay, so to that, we are looking forward to really to meeting you tomorrow again, and please use the same link shared by again my dear colleague Scott and Adams. Oh, okay, thank you very much. Okay, the link is here. I leave. Okay, yeah, over to you. So we can please repeat this instruction again, Adam, so we can really thank you very much. And it was great to meet all of you here. Without your help, we could not. Without collaboration, we couldn't. So keep up with good work. Let's collaborate to save lives. Thank you.